Hi, this is Amna, optometrist from Global College of Allied Health, Nettalam. Today I am going to discuss about the topic on anatomy of visual pathway. Each eyeball, which acts as a camera, it perceives the images and relays the sensation to the brain via the visual pathway, which comprising the structures such as optic nerve, optic chiasma, optic tract, lateral geniculate body, and optic radiations. The anatomical route through which the electric signals from the retina travels to the brain for processing, ultimately leading to the perception of sight, is called visual pathway. The components of visual pathway: the first one is retina, optic nerve, optic chiasma, optic radiation, lateral geniculate body, optic tract, and visual cortex. This is the structure of visual pathway, comprising of structures such as temporal retina and nasal retina, optic nerve, optic chiasma, optic tract, lateral geniculate body, primary optic radiations, and finally visual cortex. The first one is optic nerve. Each optic nerve starts from the optic disc and extends up to the optic chiasma where the two nerves meet. It is a backward continuations of the optic nerve fiber layer of the retina, which consists of the axons originating from the ganglion cells. It also contains the afferent fibers of the light reflex and some centrifugal fibers. Morphologically and embryologically, the optic nerve is comparable to the sensory tract of the brain because of the following points. The optic nerve is an outgrowth of the brain. Unlike peripheral nerves, it is not covered by the neurulema, so it does not regenerate when cut. The fibers of the optic nerve, numbering about 1 million, are very fine, 2 to 10 μm in diameter as compared to 20 μm in sensory nerves. The optic nerve is surrounded by meninges. Both the primary and secondary sensory neurons are in the retina. The parts of the optic nerve is intraocular, intraorbital, intracanalicular, and intracranial. Intraocular, which is 1 mm, intraorbital is 30 mm, intracanalicular is 10 mm, and intracranial is also 10 mm. The first one is intraocular parts. This part passes through the sclera, choroid, and finally appears in the eye as an optic disc. The intraocular portion of the optic nerve head has an average diameter of 1.5 mm, which expands to approximately 3 mm just behind the sclera, where the neurons acquired a myelin sheath. The optic nerve head may be arbitrarily divided into the following four portions from anterior to posterior. The first one is surface nerve fiber layer. This part is essentially composed of axon bundles, that is nerve fibers of the retina, which covers the optic disc and astrocytes. The optic disc is covered by the thin layer of astrocytes, the internal limiting membrane of Eschlings, which separates it from the vitreous, and it is continuous with the internal limiting membrane of the retina. When the central portions of the membrane is thickened, it is referred to as central meniscus of Kant. All the layers of the retina, apart from the nerve fiber layer near the optic nerve, are separated from it by a partial rim of glial tissue. It's called intermediate tissue of Kant. The second one is prelaminar region. The predominant structures at these levels are neurons and a significantly increased quantity of astrological tissue. The border tissue of the Jacobi separate from the nerve from the choroid. The third one is lamina cribrosa. It is a fibrillary sieve-like structure. It is made up of fenestrated sheet of scleral connective tissues lined by the glial tissue. It bridges the posterior scleral foramen or the scleral canal. The bundles of the optic nerve fibers leave the eye through these fenestrations. A rim of collagenous connective tissues with some admixtures of glial tissues which intervenes between the choroid and the sclera. And the optic nerve fibers is called border tissues of Eschlings. The lamina cribrosa get its rich blood supply from the circle of Sin. The fourth one is retrolaminal region. This area is characterized by a decrease in astrocytes and the accusation of the myelin that is supplied by the oligodendrocytes. The addition of the myelin sheath nearly doubles the diameter of the optic nerve as it passes through the sclera. The axon bundles are surrounded by the connective tissues, septa. The posterior extent of the retrolaminal region is not clearly defined. The next one is intraorbital part. The intraorbital part of the optic nerve extends from the back of the eyeball to the optic foramina. This part is slightly sinuous to give play for the eye movements. Its important relations of this part are as follows. The optic nerve is an orbit, is covered by the dura, arachnoid and pia mater. The pial sheath contains the capillaries and send septa to divide the nerve into fasciculi. The subarachnoid space containing the cerebrospinal fluids ends blindly at the sclera and continues intracranially. The central retinal artery along with the accompanying vein crosses the subarachnoid space to enter the nerve on its inferomedial aspects about 10 mm from the eyeball. Posteriorly near the optic foramina, the optic nerve is closely surrounded by the annulus of Synne and the origin of the fore recti muscle. Some fibers of the superior rectus muscle and medial rectus muscle are adherents to its sheath. Here the accounts for painful ocular movements in retrobulbar neuritis. Anteriorly, the nerve is separated from the extraocular muscles by the orbital fat. The long and short ciliary nerves and arteries are surrounded by the optic nerve before these enters into the eyeball. Between the optic nerve and the lateral rectus muscles are situated the ciliary ganglions, the divisions of the oculomotor nerve and nasociliary nerve, the sympathetic and the abductor nerve. The ophthalmic artery, superior ophthalmic vein and nasociliary veins crosses the optic nerve superiorly from the lateral to the medial side. The next one is intracanaliculaar part. This part is closely related to the ophthalmic artery which crosses the nerve inferiorly from the medial to lateral side in the dural sheath and then leaves the sheath at the orbital end of the canal. Sphenoid and posterior ethmoidal sinuses that lies medial to it and are separated by a thin bony lamina. These relations account for retrobulbar neuritis following the infections of the sinuses. The next one is intracranial part. This part of the optic nerve is about 1 cm in length, lies above the cavernous sinus and converges its fellow to form an optic chiasma. It is ensheathable in pia mater but receives arachnoid and dural sheaths at the point of its entry into the optical canal. The internal carotid artery runs at first below and then lateral to it. The ophthalmic artery arises from the internal carotid artery below and lateral to it. The ophthalmic artery arises from the internal carotid artery below and the optic nerve at about its middle. The anterior perforated substances and the medial root of the olfactory tract and the anterior cerebral artery lies above this part of the optic nerve. The meningeal sheath of the optic nerve, the intracranial part of the optic nerve is covered by pia only, while the intercanalicular and the infraorbital parts of the nerves have three coverings called pia, arachnoid and dura. The meningeal sheaths and the subarachnoid and the subdural spaces around the optic nerve are continuous with those of the brain. Anteriorly, all the three meningeal sheaths terminate by becoming continuous with the sclera. At the apex of the orbit, the dura split into the layers and outer it continues with the periosteum of the orbit, while the inner forms the dural sheath of the optic nerve. The arachnoid layer is connected to pia and numerous trabeculae. These connections have leads to the concept of compound pia-arachnoid meninx containing cerebrospinal fluid. Pia mater sends numerous septa into the optic nerve, dividing the fibers into fascicles. In fact, these septa are admixture of pia and glial tissues, leading to the term pia glea. The next one is optic chiasma. Optic chiasma is a flattened structure measuring about 12 mm horizontally and 8 mm anterior-posteriorly. It is ensheathed by the pia and surrounded by the cerebrospinal fluid. It lies over the diaphragm sellae and therefore presence of visual field defect in patients with the pituitary tumors indicate supracellular extension. Posteriorly, the chiasma continues with the optic tract and form the anterior wall of the third ventricles. The nerve fibers arising from the nasal half of the two retinae decussate at the chiasma. There are 4 types of chiasma, 3 types: central chiasma, prefixed chiasma and postfixed chiasma. The central chiasma is present about 80% of the cases. It lies directly above the sella so that the expanding pituitary tumors involve the chiasma first. The second one is prefixed chiasma. It is present in about 10% of the normal cases. It is located more anteriorly over the tuberculum sellae. In such situation, the pituitary tumor may involve the optic tract first. The third one is postfixed chiasma, is present in the remaining 10% of the normal cases. It is located more posteriorly over the dorsum sellae so that the pituitary tumors are apt to damage the optic nerve first. The next one is relation to optic chiasma. Anteriorly continues with the anterior cerebral arteries and their communicating arteries. Posteriorly, it has tuber cinereum and infundibulum, pituitary body, mammillary body, and posterior perforated substances. Superiorly, that is from the above, it has the third ventricle, and inferiorly from the below, it has hypophysis. Laterally, extra cavernous part of the internal carotid artery and anterior perforated substance. The next one is optic tract. These are cylindrical bundles of nerve fibers running outward from and backwards from the posterolateral aspects of optic chiasma between the tuber cinereum and anterior perforated substance to unite with the cerebral peduncles. Each optic nerve consists of the fibers from the temporal half of the retina of the same eye and the nasal half of the opposite eye. Posteriorly, each optic tract ends in the lateral geniculate body. The pupillary reflex pass on the superior colliculae through the superior branchium. The next one is lateral geniculate body. These are oval structures situated at the termination to the optic tract. Each geniculate body consists of the 6 layers of neurons alternating with the white matter. Fibers of the second neurons coming via the optic tracts release in these neurons. The next one is optic radiations. The optic radiations or geniculo-Callerian pathway extend from the lateral geniculate body to the visual cortex. They passes forwards and then laterally through the area of veruncle as optic peduncles, anterior to lateral ventricle and transversing the retrolenticular part of the interior capsule. Behind the sensory fibers, the medial to auditory tract. The fibers of the optic radiations then spread to the fanways to form a medullary optic lamina. This is at first the vertical, but it becomes horizontal near the visual cortex. The inferior fibers of the optic radiations which subserve the upper visual fields first sweep anterolateral inferiorly in the Meyer's loop around the anterior tip of the temporal horn on the lateral ventricle and into the temporal lobe. The superior fibers of the radiations which subserve the inferior visual field proceed directly posteriorly through the parietal lobe into the visual cortex. The next one is visual cortex. It is located on the medial aspects of the occipital lobe in and near the calcarean fissure. It may extend onto the lateral aspects of the optical lobe but limited by the semilunar sulcus. The sulcus lumatus. The visual cortex is subdivided into visuosensory area. Recently, a modified nomenclature for recognizing 5 visual areas has been described, which are as first visual area V1 and in the area 17. The second visual area is V2, occupying the greater part of the area 18 but not the whole of it. The third visual area V3, occupying a narrow strip over the anterior part of the area of 18. And the fourth one is visual area V4 within the area of 19, and the fifth one V5, which is at the posterior end of the superior temporal gyrus. A section through the visual cortex of a fresh brain can be identified by the naked eye by the presence of a white line, the stria of genere. The next one is arrangement of the nerve fibers in different parts of the visual pathway. That is in the retina. The arrangement of the nerve fibers in the retina occurs. No overlap between the lower and the upper half of the fibers of the peripheral part of the retina. The line dividing the nasal and temporal fibers passes through the center of the fovea. Hence, the temporal macular fibers remains on the same side while the nasal one across. Upper temporal retina fibers are separated from the lower by the macular fibers and arrangements which hold through the central visual pathway. That is, the next one is in the optic nerve. That is in the optic nerve head. An arrangement of nerve fibers in the optic nerve head is exactly same as in the retina. The second one is which is in the distal region, that is behind the eye. In the distal region of the optic nerve, the nerve fibers are distributed exactly as in the retina, that is upper temporal and lower temporal fibers are situated on the temporal half of the optic nerve and are separated from each other by a wedge-shaped area occupied by the papillomacular bundle. The upper nasal and lower nasal fibers are situated on the nasal side in the proximal region, that is near the optic chiasma. In the proximal region of the optic nerve, the macular fibers are centrally placed. The next one is which is in the central optic chiasma, that is the nasal peripheral fibers constitute about 3 quadrants of the fibers and crosses over to the medial part of the opposite optic tract in the following manner. The lower nasal fibers in the optic nerve transfers to the chiasma or low anteriorly, so that the first affected in the tumors of the pituitary part producing by the temporal quadrantic field defect. These fibers from the convex loops in terminal part of the opposite optic nerve and then cross to the opposite tract and occupy in the lower quadrant. The upper nasal fibers of the optic nerve transfers to chiasma high and posteriorly. These are involved first by the lesions coming from the above chiasma. After crossing occupy the upper nasal quadrant of the opposite optic tract. Some of these fibers make the loop in the ipsilateral optic tract before the crossing. The temporal fibers from the retina, which occupies the temporal half of the optic nerve, remains uncrossed and run backwards in the lateral part of the optic chiasma to reach the dorsal part of the optic tract. The macular fibers, which occupy the central part of the proximal end of the optic nerves, keeps these portions in anterior part of the chiasma. Then the crossing macular fibers get separated from the uncrossed fibers and then passes a bundle obliquely backwards and upwards to desiccate in the posterior most part of the chiasma, which is related to the supraoptic recess. Lesions here may produce the central temporal hemianemic scotoma. Other fibers in addition to the visual fibers, the optic chiasma also contains commissural fibers, pupillary fibers, and fibers connecting the two medial geniculate bodies, the globulus pallidus and the hypothalamus. Then in the optic tract, visual fibers are rearranged as follows, that is macular fibers both uncrossed and crossed macular fibers from the opposite retina occupy the dorsolateral aspect of the optic tract. Upper peripheral fibers both uncrossed and crossed are situated medially to the optic tract. The lower peripheral fibers both uncrossed and crossed are situated laterally in the optic tract. The other fibers, besides the visual fibers, the optic tracts also contains other fibers are described in optic chiasma. In the lateral geniculate body, the portion of the visual fibers are, that is the macular fibers, coming in the optic tract occupy the most posterior 2/3 of the lateral geniculate body. The upper retinal fibers occupy the medial half of the anterior 1/3 of the lateral geniculate body. The lower retinal fibers occupy the lateral half of the anterior 1/3 of the lateral geniculate body. The relay of the second order neurons in lateral geniculate body are again the third order neurons of the visions. The axons of the second order neurons snaps with the dendrites to the neurons of LGB. There is a regular point-to-point localization of the retina in the lateral geniculate body nucleus, which is also carried from the later to the visual cortex. The LGB has got 6 laminae. The cross fibers end in the laminae 1, 4 and 6, while the other uncrossed fibers ends in the laminae 2, 3 and 5 in such a way that those from the corresponding parts of the retina end in the neighboring parts of the adjacent lamina. Therefore, the smallest lesions of the retina result in the degeneration of 3 laminae of the LGB in which retinal fibers end. Hence, the conducting unit in the optic nerve fibers is a 3 laminae unit. Since the optic radiations commence from all the 6 lamina, so lesions on the visual cortex result in degeneration of all the 6 lamina of the LGB. Next one is in the optic radiations. In the optic radiations, there occurs a temporal rotation of fibers, thereby the upper retinal fibers occupy the upper parts of optic radiations. The lower retinal fibers occupy the lower parts of the optic radiations. The macular fibers lies in the central part of the optic radiations, separating the upper retina from the lower retinal fibers. Other fibers besides the visual fibers, the optic radiations also contain the fibers that passes from the cerebral cortex to LGB to the superior colliculus and the oculomotor nuclei. The next one is in the visual cortei. The visual cortex is also called the cortical retina, since a true copy of the retinal image is formed here. It is only in the visual cortex that the impulses originating from the corresponding points of the two retinae image. There is a point-to-point projection of the retina in the visual cortex in such a way that the right visual cortex is concerned with the perception of objects situated to the left, and the vertical medial line in the visual fields and the left visual cortex is with the objects situated to the half right. In other words, the right visual cortex receives impulses arising from the temporal half of the right retina and the nasal half of the left retina, and the left visual cortex receives those arising from the temporal half of the left retina and the nasal half of the right retina. The visual fibers contained in the optic radiations are laid in the visual cortex in the following manner. Fibers from the macular area lay in the extensive area placed posteriorly in the visual cortex, fibers from the peripheral retinae and anterior to macular fibers. Those from the upper retina above the calcarine sulcus. The visual areas give off efferent fibers also. These reach various parts of the cerebral cortex in both hemispheres. In particular, they reach the frontal eye field, which is concerned with the eye movements. Like other sensory areas, the visual areas are therefore to be regarded as partly motor in function. This view is substantiated by the facts that movements of the eyeball and head can be produced by the stimulation of this area 17 and 18, which constitute the occipital eye field. Efferents from the visual areas also reach the superior colliculus and pretectal regions and the nuclei of cranial nerves supplying muscles that moves the eyeballs. There is physiological evidence of corticogenicular projections. Fibers are also reach the thalamus. The next one is blood supply of visual pathway, mainly supplied by the pile network of vessels except the orbital part of the optic nerve, which is also supplied by the axial system derived from the central artery of the retina. The pile plexus around different parts of the visual pathway get contributed from different arteries. These branches of the carotid arteries which contribute to blood supply of visual pathway are ophthalmic arteries, small branches of internal carotid artery, posterior communicating artery, anterior cerebral arteries and middle cerebral arteries. The arteries of the vertebral systems are cortical, central and choroidal branches from the posterior cerebral arteries. Similar to the brain, the visual pathway is mainly supplied by the pile network of